Your stomach can influence several parts of the body that have sort of nothing to do with the stomach on the face of it. But let's talk about how that happens, why that happens, and what you can do about it naturally. Because your stomach can influence your heart, causing heart palpitations. It can influence your diaphragm so that you're having shortness of breath, and it can influence your nervous system so that you have anxiety or panic attacks. Now, our medical system is what's called siloed, meaning if you're somebody who's had heart palpitations and you've run to the ER, absolutely sure you are having a heart attack, they checked out your heart. And if you went to your doctor and he's like, I'm really having trouble breathing, they're going to check out your lungs. And if you're suffering from anxiety, they're going to tell you you need to see a psychiatrist and you need some drugs because your brain is not functioning optimally. That's what I mean by silo, right? And then of course for the indigestion, you see a gastroenterologist and he or she puts you on medication for that because we're very Band-Aid oriented. Here's the symptom, here's the Band-Aid to modify that symptom or manage that symptom. Now on the face of it, that seems to make a lot of sense. But when you're on the receiving end of it and you have things like acid reflux, or you have indigestion, you have a lot of bloating, and you also have heart palpitations, and you're also short of breath, and you're also anxious, you're in a nightmare. And you're being given drug, and then on top of it, because of the anxiety, you're being told, it's probably all in your head, you really need to manage your stress. And then it all focuses on your stress. But that's cart before the horse, because prior to all this happening, you really weren't an anxious person. But if you're someone who's ever experienced heart palpitations, it is a very anxiety-provoking moment because you think you're dying of a heart attack. So it's anxiety that totally makes sense. Okay, let's back up. So here you have indigestion, maybe you've had acid reflux for years. It's so easy to treat acid reflux, things like Tums, over-the-counter medication. That can go on for years where you're like, yeah, I take that, it's fine, it seems to handle it. But then it's getting worse, it's getting worse, it's getting worse, and then you seek out your doctor and he or she puts you on stronger medication, and then next stop, gastroenterologist, and you get an endoscopy. Maybe you have inflammation of your esophagus, inflammation of your stomach, called gastritis or esophagitis. Maybe you have a small hiatal hernia. All these things are told to you, but what's also told to you is that your only choice is to take antacids, to take medication. And same thing for your heart. When you go to the cardiologist and they've checked your heart out completely, only for you to be told your heart's fine. You did not have a heart attack, you do not have heart disease, but we can put you on a med to slow down your heart, and that will help handle some of the anxiety as well. So in desperation, you do that. But where are we? We are in a big imbalance. It's affecting a lot of different systems of your body. And I'll tell you, over time, you might be in the trajectory right at the moment where you're like, yeah, I'm taking a lot of drugs, I don't love it, but it's sort of stabilizing me, but you're not really yourself, and you're reliant on all this medication and they do have side effects. Or maybe you're further down the road where you're like, yeah, I'm so fed up with this, I feel horrible all the time, I don't know what to eat, and my heart races out of the blue whenever it wants, and there's no rhyme or reason. The anxiety just comes upon me, and it's a horrible way to live. And I hear over and over again, I just want my life back. I just want to be normal again. I want to be me again. That's what I hear over and over again. So I'm here to tell you that you can be normal again, and at the basis of this is truly a digestive problem. And if you've watched the channel a bit, you've heard me describe this a lot, but maybe this is your first video, so let me describe it for you. And that is that your stomach is situated anatomically just under your left rib cage. Right above it is your diaphragm, that sheet of muscle. It's on both sides, dome-like sheets of muscle that they move. The diaphragm moves to let air in and out, and it just kind of floats up and down. And of course, we don't think about breathing. You shouldn't have to think about breathing. It's automatic. And then also, so we have the stomach, we have the diaphragm, and then right above that is the heart. So anatomically, these three organs are very close to one another. And we know that there's something called a gastrocardiac reflex, meaning when the stomach gets irritated and it gets pulled up, it pushes on the diaphragm spasms, and the diaphragm elevates, and now we're getting in the way of the heart. It doesn't like that, and you can get these heart palpitations. So we understand the mechanism, but unfortunately traditional medicine doesn't understand the mechanism. They don't tend to think big picture. They don't look at your body as a whole. They don't take a list of symptoms and say, what could be underneath this? Instead, they go, treat this symptom with that, treat that symptom with that, treat that symptom with that. And the problem is nobody's getting to the root cause of why. Now with hiatal hernia syndrome, the root cause tends to be digestive more than anything else. And so we are looking at how the stomach is functioning, how your small intestine is functioning, how your liver is functioning. So we're looking at all of the digestive organs to find out, where is this inflammation coming from? Why is that stomach being compressed? And when it is compressed, then you get acid reflux because the acid moves up your esophagus. But why? See, that's the key point. You should understand the what, and hopefully I've described that pretty well. But why? What created it for you? And just to make sure I touch upon it, where the anxiety comes from is that when your diaphragm is kind of moving like this instead of floating effortlessly, getting you all the air you need, your nervous system, as a protective response, sends out fight or flight hormones. So you get into this, I'm alert, I'm ready, I don't know what's up, but there's not enough air, okay? So that's what happens. So that's how the anxiety comes upon you, is your body is doing this as a protective response because you're just not getting enough oxygen. And it's subtle because you're still breathing, obviously, thankfully, but the nervous system has a very low tolerance for oxygen levels changing. The other thing that happens is that there's a cranial nerve called your vagus nerve, and it goes to pretty much every organ you have. It comes out of your upper neck, coming from your brain, but it wraps around your lower esophagus like a web, and when that stomach gets pushed up, that affects the vagus nerve at the base of the esophagus, and a response to that is anxiety as well. And you can have anxiety, you can have mood swings, you can have heart palpitations. So that's that correlation. So there's two reasons why in this scenario you can have anxiety, but it's not here. You know, it's not that suddenly you're an anxious person. This is a phenomena that's occurring that makes sense. But to unravel it, you have to figure out where it all started. And typically that is in the digestive tract. So that's what we specialize in, is hiatal hernia syndrome. I wrote the book on it. And the reason I did is there's up to 20 different symptoms. I just have labeled the top 4 or 5, but there's up to 20 different symptoms that can kind of take you on a wild goose chase with your doctor, where, you know, once again, oh, well, your heart's not diseased, your lungs are not diseased, you know, yeah, you have reflux, but that couldn't be causing it. That's what you hear all the time. Oh, that couldn't be causing it, when it is. So the beauty of this program that we've developed in the past 20 years, that we've been specializing this, helping over 5,000 people restore their life and get their life back. The beauty of the program is it's natural. No drugs, no surgery. So that's exciting, and I wanted to share that with you and really put it all together, because so many of you are suffering, or you know somebody suffering, and it can really ruin their life, and it's so unnecessary because it's not hard to fix. So call us for a consultation, and it's just $75, and we will then have you sit down with a clinician who's expert in this area and figure out, can we help? You know, go over your symptoms. Does it make sense based on the kind of work that we do? Because that's what it's all about, is helping you. So please reach out. We're here for you, and I'll talk again soon.